Certainly, as we're all aware, post-COVID, things have taken, to put it mildly, a bit of a hit. So certainly, even before COVID, venous care certainly had its flaws, its faults. There were things that could have been improved. But certainly since COVID, all of a sudden now the waiting lists are rising, patient assessments are rising, and it's in a sorry state at the moment. I think the biggest disparities are regional. They're obviously multifactorial, and there are a number of things ongoing. As I tried to present earlier, we are now post-COVID, and in England, people are discussing waiting lists of patients waiting for a year, 2 years for treatment. Even before COVID in Northern Ireland, it was commonplace for people to be waiting 1, 2, 3, 4 years for treatment. So these disparities were huge and were regional. But I mean, I think COVID is again making things worse, or magnifying the situation. I think the disparities need to be looked at from a number of perspectives and a number of levels. I think certainly collaborative working needs to be improved, and systems need to be put in to improve the pathways for patients. I think we also need to look at how at the workforce, and also, although controversial, give consideration to non-medical people delivering assessments and delivering treatments. I think certainly if you start taking those measures, you can at least improve the speed of the delivery of a service. Digital health will increase dramatically. I think one of its roles would actually be in the review of patients who need review. I think digitally it is difficult from a venous point of view to scan and assess someone, but certainly you can find out exactly what is going on, what has been happening, what are the current issues. I think also, if you're actually trying to improve a service, you need a good digital infrastructure to be able to communicate, get the information out, and make sure that everyone is aware of what's going on with the patients. I think the take-home point from this presentation was we need to think about how we work in the future. The way we were working before has led to, with COVID in England, without COVID in Northern Ireland, significant increases in the waiting list. So therefore, we need to work together collaboratively to improve the pathways and speed up the delivery of service.